Hello. Hello. My hair's kind of okay. What's new? I was thinking about healthcare and this country and things like that, and the different ways that people are trying to put across their points, and the amazing audacity of some people who are willing to lie to kill this initiative. Out and out lie, telling people, oh, you'll die, or people are dying now. Let's look at it this way. Hundreds of thousands of jobs have been lost since last year. Hundreds of thousands of people lost their jobs, which means hundreds of thousands of people lost their insurance. Lost their insurance. They don't have it anymore. It's not that they're bad people, it's not that they are lazy or whatever. They lost their jobs because of this economy, and they are not insured. How many of them who used to have insurance, now do not, have died since? I wish I could get my hands on those figures. How many uninsured people die every month largely due to being uninsured? No one's talking about that. You talk about an August recess. How many people will die during August that have no insurance, that may not have died if they had it? I'm lucky. I'm very lucky. I still have my job. I still have my insurance. I can still get to my doctor's office and have them do the blood work and have them bill my insurance directly. Even if there's something left over after what insurance pays, I can afford that, but I'm lucky. A lot of people aren't lucky because they still don't have their jobs. They lost their jobs. They don't have new ones. So they don't have insurance. And so the public option, the key word being option, it's not the public mandatory, it's the public option. If there had been a public option, I would have used that for the 3 years I was not insured by a large company. And then I would have dropped it when I would have been working for a company that had their own plan. I don't understand why that's such a horrible thing. And all these hundreds of millions of people out of work. They're putting off stuff for their health. If they're diabetic, they're screwed. Heart problems, they're screwed. I mean, how do you think they're going to pay for meds, supplies? So they'll die. Do you get that, Republicans and blue dogs and whatever the hell else you are out there? Do you get that they'll just die? Do you understand? People are dying now. And people will die during the recess while waiting for the public option. These are people who had work and lost their jobs because the economy went wongo, and not their fault. Every one of us knows someone who's lost their job, okay? Every one of us knows someone who's lost their job. Don't give me that it's not a big problem. It's a huge problem. So, if anyone can help me find the records or the numbers of how many out-of-work people now have health conditions that they will die in the month of August during the recess, I'd love to know those figures. how many people die each month in this country, largely because they have no insurance to take care of themselves, to help them take care of themselves. If anyone can point me toward those numbers, I'd appreciate it. I think it's a rather frightening number, but that's a guess. So, you have a good day. And I hope you are lucky enough to have a job where you have insurance. And if you're not, I hope to God that the public option becomes real very soon for you. Take care now. Bye-bye.